when I look at a face, I just love to kind of look at the whole package. It's not a sales pitch. I'm not trying to convince people to do more than they want to do, but people have no idea all these little things we can do. And when I can add them together and do them safely during one recovery, it really is nice. But yeah, sometimes we just need to do just a facelift. Sometimes we only need a neck lift. Sometimes we only need to do eyelids and certain little things. But when somebody just kind of says, I look older or more tired or not myself anymore, I can kind of tell them all the things we might consider. And some of those are non-surgical. I mean, there may be lasers and fillers and injectables, which we've talked about. Welcome to Plasticos, the everything you ever wanted to know plastic surgery podcast with me, Dr. Christopher Park, and host Kym Anderson. We will discuss surgical and non-surgical plastic surgery options and the ways that they improve your health, mood, personality, and success.
Hi, and welcome to Plasticos. It's the podcast where you can get all your questions answered that you have about plastic surgery. I'm Kym Anderson, along with Dr. Christopher Park, board-certified plastic surgeon from out of Mobile, Alabama. Now, today, Dr. Park, we're talking about facial rejuvenation. And what exactly is it? Because when you think of your face, you're always thinking about facelift.
Right. I mean, facelift is one procedure, and really the facelift addresses the lower half to two-thirds of the face. So when I think of facial rejuvenation, and basically when a patient comes in, I kind of look at them from their hairline down to their collarbone, and I kind of recommend all the things that I think we may want to do. They can do one or all the above. But so essentially, when I say facial rejuvenation, I'm going to look, I always think from the top down. So I'm going to look at their eyebrows. Are they where we want them? Are they a little bit too high, a little bit too low? What do we need to do about that? I'm going to look at their upper eyelids, which we've talked about in another podcast, whether they need an upper eyelid lift because the skin is excessive and starting to make them look older. And if it gets severe enough, it can actually block their vision. I look at the lower lids. Do people have bags or wrinkles or folds or dark spots under their eyes? I'm going to evaluate the face and neck, usually together. A face lift almost always includes a neck lift, unless it's a mini face lift. And then I also have a lot of little adjunctive procedures that I do. I look around the mouth. I mean, at the same time as a facelift, you can do a lip lift, which we usually make a little incision underneath the nose, and it lifts the lip up in the middle, or we can do our corner of the mouth lift, either if the lip is just small or if it's pouty, pointing down a little bit. Also, somebody's lips may need to be fuller. Now, we could also even look at the nose. Now, we may not do all that at one time, but the nose can show signs of aging. Even if somebody likes the shape of their nose, as we get older, it tends to get larger and it tends to plunge or drop down. Of course, we can look at other things. There's all these little fun minor procedures we can do that people don't even really know the names of. But I mean, we can do little cheek implants or filler. You can do chin implants. There's all sorts of things that we may be able to do to just make you look better. These are not Hollywood, let's make you look totally different like you're now in the witness protection program. We're talking about just improving things. So when I say facial rejuvenation instead of facelift, that's what I mean. I am looking at the whole package and kind of what I would do if given the ability to kind of do whatever I want.
So it's not changing your look, it's just enhancing your look.
Correct. I mean, to me, my goal is always natural facial rejuvenation, essentially on average trying to take 10 years off of what you look like. We're not trying to make you look like a different person. I mean, those possibilities are out there, but that's not what I'm talking about when I say facial rejuvenation. Just think of it as taking 10 years off.
So when you have people come in who want something like this, are they generally older individuals?
So, yes, traditionally people used to wait too long, in my opinion, late 60s, early 70s, and come in, and they had a very dramatic change, which was great, except it was so dramatic, their kids noticed, their grandkids noticed, their friends noticed. So the ideal situation is to start at a reasonable age. I think 55 is a great age to kind of consider your first facial rejuvenation. We're not having to be as extreme. It's not going to be as expensive. It's not going to be as difficult. We may not have to do all of the 8 or 9 things we just discussed. We may do 1 or 2 or 3. That may be all you ever do, or we can keep touching it up and adding as we go.
You mentioned the nose. I did not know that our nose changed as we aged.
It does. I mean, our skin on the nose tends to thicken, especially patients with rosacea, which is more common than you think. But even in all of us, the nose skin tends to thicken, get oiler. But then also it will plunge. The tip will a lot of times just go down, and it's pretty entertaining.
So that's why it makes rhinoplasty and different surgeries like that so popular, because people can notice the change.
Mm-hmm.
Oh, man, I don't want my nose to get any oilier than what it is. Constantly having to blot it. you said that they don't have to have all of those procedures at one time.
When I look at a face, I just love to kind of look at the whole package. It's not a sales pitch. I'm not trying to convince people to do more than they want to do, but people have no idea all these little things we can do. And when I can add them together and do them safely during one recovery, it really is nice. But yeah, sometimes we just need to do just a facelift. Sometimes we only need a neck lift. Sometimes we only need to do eyelids and certain little things. But when somebody just kind of says, I look older or more tired or not myself anymore, and I can kind of tell them all the things we might consider. And some of those are non-surgical. I mean, they may be lasers and fillers and injectables, which we've talked about.
What about younger people? Is there a way to preserve your youth longer? Maybe coming to get some services at the med spa?
Absolutely. I mean, the things that are hard on our skin are life. I mean, living, age, number of days we're alive. We can't change that one. Mm-hmm. 2 is sun. So you need good sun protection, and we could harp on that for a while, but you need sunblock, not sunscreen. And you want to make sure it blocks against UVA and UVB, and it needs to have a physical barrier, which is usually zinc oxide or titanium dioxide. All these synthetics, there are some good ones, some bad ones, and you really have to kind of learn to flip it over and read the labels or buy it from a medical provider. Dermatologists or plastic surgeons are going to always carry good stuff. Doing that every day, even when you work downtown, even when you work inside, those hours in the car, the hours near a window, still, they may not give you a sunburn, but they are causing sun damage. And the more sun damage you get, the more you damage the elastin and the collagen in your skin. And we all know the word collagen. We may not know the word elastin, but you know what it means because you know what elastic means.
Yes.
It is a protein that makes things tighten up, and it is damaged by the sun. Obviously smoking, magnify all that I just said about the sun times 100. And that's what that's doing to your skin. So those are 3 very important things you can do. Now, in terms of what we can do to help, we can help prevent damage. Then you can help rebuild the skin with a good skincare regimen is important. Mm-hmm. And we used to use a lot of Retin-A, and now we're using more retinols. It's a little bit gentler on your skin. But that is essentially, I think of it as the fertilizer for your skin.
Okay.
And then there's treatments we can do. So whether it's a chemical peel or a laser that is taking off the bad things, stimulating your collagen elastin to rebuild, those are helpful things. And then once we want to address more specific things, even at a young age, so I think of the neurotoxins, which we've talked about before, as a very good preventive procedure. There are certain muscles that cause wrinkles in our face, and if you can relax those wrinkles, you're not going to have those wrinkles. And you won't have problems with it as long as it's injected where you need it to be. And we know exactly where to put them. Fillers can add volume. And the volume can fill in a wrinkle you already have or just add enough volume that they're not going to happen. So those can be done in young people as well.
Okay, and that kind of just keeps that youthful look for when that time comes, when you do want to come visit you and decide that you want to tighten and lift and do whatever else you do for your face. Now, what's the recovery time for facial rejuvenation?
Depends on what we do, but it is faster than you think. Even a full, everything I just talked about is about a 2-week before you are kind of ready to get out in public. Now, if I work above your eyes, whether it's your brows, your upper lid, or even filler, you may get bruises and black eyes. So the amount of bruising you get is going to last 2 weeks, whether it's minor or major. So even when we do these major facial rejuvenations and do 7 procedures at one time, like your brows, your upper lids, your lower lids, a lip lift, corner of the mouth lift, face lift, neck lift, we can do all that at one time. And you look pretty rough at first.
Are you mummified like you used to see in the old movies?
I do like a good facial wrap if we do all of that. And then we like ice on the eyes. So you're pretty wrapped up for the first couple of days. And we usually see you back in the office within 24 to 48 hours, depending on which day of the week it is, and take that first wrap off for you. And then elevation is key. And you are very swollen. I mean, if you do all of that, and not a mini facelift or just an eyelid lift, but if you do all that, you're very swollen. Day 3, you don't think you're ever going to look normal. But by day 7, you're starting to get there. And by day 12 to 13, you're usually normal. I mean, maybe a little bit of redness, maybe a little bit of swelling, but you were pretty much normal.
So just plan not to go do a lot of outside work for 2 weeks.
Yeah, I mean, you were going to look funny for that first 10 to 12 days, just black eyes and swollen. I mean, people are going to know you had something done.
But then it'll be well worth it in the end.
Absolutely.
Now, we've talked about facial rejuvenations, and you said there's a little bit of difference between that and a facelift. So what exactly is involved in a facelift?
In my opinion, almost all facial rejuvenation is going to include a facelift. But I was just talking about how those other things are nice things to add to it. The facelift is the linchpin. It's the key to everything. And the term that we actually use as plastic surgeons is cervicofacial rhinodectomy. Big word. But what that means, cervico, it means neck, and then face. So it's usually face and neck together, and rhinodectomy is essentially wrinkle removal. So just like every other procedure we've talked about, it's not a rubber stamp or a cookie cutter. I mean, we do them all personalized. But essentially what we are doing is lifting up the skin to determine how much we want to remove, but more importantly, to show me the deeper structures of the face. Gone are the days where a facelift is just removing some skin. I mean, and there are people that still do it, but not me. I mean, we're going to do a deeper support system. There's more fibrous, thicker structures in your face. The most common one is known as the SMAS, so the superficial musculo-aponeurotic system, that we're going to grab and lift up and move and tighten, and everything follows with it. It's not just pulling the skin tight like you're making the sheets of your bed.
Okay.
And that provides for longer-term support and a very natural result.
And unlike the ones that you've seen before where the people look pulled back.
So the term we use is called the windswept look.
Yes.
And just like everything else in life, it's the few bad apples ruin the bunch. I mean, people all worry that a facelift means they're going to look like that. I mean, those are the ones that had a problem, or they've had 4 facelifts. Our goal is for you not even to hardly remember that you had a facelift. You just look good. You just look younger and rested and better and not anything weird.
And so that's too, for somebody, we've talked about this before, so many people want their privacy here, and that would include those type of people, because everybody doesn't have to know that you've had a facelift. They just think maybe you went on vacation and got more rest.
That is my goal. I have yet to and never want to be told that they felt like they were overdone. I would much rather have it be natural and rested. I mean, if you're looking to be unbelievably tight and unnatural looking, I don't want you as my patient. I want a natural result.
And you've talked about before, let's touch on this again, smokers, people who smoke and they've smoked for a long time, they tend to age a little faster.
Absolutely.
Are they still not candidates for something like a facelift?
So the actual specific facelift, if I had a smoker that could not quit smoking, I dramatically have to modify things. I'm barely going to remove any skin. I'm not going to undermine, which is a term we use in surgery where we lift the skin up. So it's really not probably worth their time and effort. So I tell everybody to quit. And I pride myself on sticking to that. And I'm also proud of myself that I've helped a lot of people quit smoking that never thought they could, because you're giving them something fun and beneficial at the end. I require people be completely nicotine-free for 6 weeks before surgery, and the longer, the better. And so that's nicotine-free. So even vaping is bad, and nicotine gum and nicotine patches are bad. The nicotine causes the blood vessels to spasm. So just imagine you have a hose in your yard and you're trying to water the lawn. Now smoke a cigarette, and it's the equivalent of stepping on that hose. And it takes a month for that nicotine to go away.
So it just stops the blood from flowing?
It makes the blood vessels spasm, so it tightens up. So if you imagine your 1-inch hose becomes an 1/8 inch of a hose for a month. And it's just the muscles in the smooth muscle in the artery and arterioles tightening up. And so you get less flow because there's a much smaller diameter.
I think that they would be thankful later on, because the fact is that they're not aging as fast now.
Correct.
Stopping them smoking will stop them from aging so fast.
That's a completely additional benefit. But just in terms of healing, that's the acute thing. And like I said, what I'm proud of is a lot of them never go back to smoking. They didn't,
That's awesome.
They had that prize at the end of getting the surgery they wanted. And then once they quit, yes, they don't continue to age as fast.
I'm sure there's so many more questions that people may have for you that I can't even think of really off the top of my head for facial rejuvenations and facelifts. So how would they get in touch with you?
It is a very personalized consultation. Every face is different. So it's one we really do like to do in person. And the best way to do that is make an appointment by calling 251-340-6600. They can always start their inquiry via the website, which is mprsd.com, or email info@mprsd.com. But this is a good one to sit down and put my fingers on you and let me make some decisions in my own head and then translate what I'm thinking to you.
Now, on the website, are there pictures that people can see of other patients who may have had some procedures done that they're interested in?
Absolutely. We have lots of pictures. We don't get nearly the volunteers for face stuff as we do for other stuff, especially in our type of community. So we don't use a lot of face stuff on the website. We have a lot, even more we have in the office that people didn't allow us to use their pictures, but not on the World Wide Web. And then we go over all that with them in person.
Okay. Thank you.
Thank you. Thanks for listening to Plasticos Podcast. Please follow us on our Facebook page, and please rate and review Plasticos on iTunes and anywhere else you get your podcasts. This really helps others discover this show. Have a plastic surgery question you want us to talk about? Contact us on our Facebook page or email me at drpark@mprsd.com. That's drpark@mprsd.com. Plus, we really want to hear what you think about our episodes, so let us know. Thanks again for listening, and remember, insist on credentials, invest in results.